hotel. St. Swithin's Hospital is going to be pulled down. You're going to build an hotel, and we're going to become part of High Cross.
In a way, yes.
I suppose, Sir John, you haven't slightly confused your function as financial chairman of the University Grants Commission with your function as a director of McKendrick Construction and District Hotels Limited.
My dear Sir Geoffrey, it is a ludicrous accusation. As I told you, this is a decision of the entire Grants Board.
How dare you come here and tell me? The very person who ripped open your belly, hacked out your gallbladder and saved your miserable life for a lousy £250 that might... Our hospital is to become part of High Cross.
Good morning, sir.
What do you want?
Oh, I'm doing the follow-up clinic on some of the old bellies you've ripped open.
Waring, if you wish to add to the statistical notes in my follow-up survey on patients upon whom I have performed a complicated operation of vagotomy and pyloroplasty, please do. But remember that no one at St. Swithin's, least of all me, rips open bellies!
No, sir.
So as I say, Professor Loftus,
Sir Geoffrey, Sir John.
St. Swithin's will cease to exist, but it means High Cross will become the largest and most important medical teaching unit in the country. And I think I can say, without doubt, that you will be offered the post of Professor of Surgery.
Oh, thank you very, very much indeed, Sir John. I shall be absolutely delighted. After all, what is St. Swithin's? A crumbling monument to medical incompetence and a perfect site for an hotel. I really look forward to working at your wonderful new High Cross.
Splendid.
Sir, are you...
What do you want, Waring?
Oh, I was doing your follow-up notes, sir.
Still?
No, I'll finish them, sir, but...
Well, then get out.
Well, no, sir. What I wanted to ask
What?
you... Are you serious?
Of course I'm serious. Get out.
No, I didn't mean that, sir. What I was talking...
Waring!
Oh, yes, sir.
Get out! I'm sorry, Sir John. It's just that St. Swithin's means a lot to me. To all of us. It's got centuries to tradition. It's older than High Cross.
It isn't.
It's got a great history of scientific discovery.
It hasn't. High Cross has had 2 Nobel Prize winners.
All right, but we turn out bloody good doctors. And that's what you should care about.
That's naughty.
Hey, come here.
Can't stop, the bar's open.
What? Oh, no, forget that. They're going to pull down St. Swithin's.
Fine, I'll get you a pint of... Pardon?
Yes. St. Swithin's is going to become part of the High Cross group, and Professor Loftus is going over there to become Professor of Surgery.
And Matron's going to open a strip club.
It is true. Sir John Pollock's in there now.
Pollock? That Pillock?
Yeah. Paul, I want you to nip in there and see if you can catch anything.
What shall I say I've come about?
Wait a minute, will you, Collier?
Very well, Sir Geoffrey. The University Grants Commission wishes, above all else, to be fair. When would you like me to see round St. Swithin's?
Any time.
Very well, this afternoon. And I'll bring Lord Wagstaff with me, so you can't claim I run the committee.
Good. And I'm sure you'll not fail to notice the difference between the 2 hospitals. Good morning.
Good morning. About 2 o'clock then.
Yes, 2 o'clock. Collier,
Sir Geoffrey?
what do you want?
Nothing, sir.
Then why are you here?
You wanted to see me, sir.
No.
You had some work for me, sir.
No.
You were bored and you wanted to chat.
No.
I give up.
Get out! Miss Rogers, would you see if you can get an appointment for me with the chairman of the University Grants Commission this afternoon, 2:30?
And then I inserted the self-retaining retractors and then simply excised the spines and interspinous ligaments with bone-cutting forceps.
Fascinating.
Thank you.
Dr. Bingham, did you know that the Chapel of St. Swithin's...
I haven't finished yet. Then I took a Hudson's burr and I drilled through the raw edges, you see, of the bone, like that.
Listen, Duncan's had a brilliant idea.
Yeah.
He reckons if we can stop Loftus getting his job at High Cross, he'll have to stay here and support the hospital.
Yes, but how can we do that?
Well, we make Loftus look really incompetent this afternoon when Sir John Pollock's around.
Yeah, show how he's mismanaged the finances.
Can't handle the staff.
Yeah, neglected the patients.
Of course, if we really wanted to deal with Pollock, we could tell the rugby club.
We don't want to kill him.
Waring, I'm sorry about earlier. I was a bit on edge. Look, I got a couple of very important visitors coming round this afternoon. I want you to show them round.
Ah, yes.
Yes, be at my office at 2. Collier.
Sir.
Clark.
Yes?
I want everyone here to make sure that these two visitors get a picture of efficiency and cheerful, spontaneous loyalty, understand?
Yes, sir.
Good, because otherwise I'll wring your bloody necks.
Professor Loftus, could I have a word? I have made a most remarkable discovery about the chapel.
Later, Padre, later.
Honestly, that chaplain, he's so boring. He went on and on and on and on about the history of the chapel. Honestly, I could hardly get a word in edgeways.
Lawrence,
Yes?
they're pulling down St. Swithin's.
Oh, really?
Yeah, so we're getting together this afternoon with the students and the nurses to make Loftus look really incompetent.
Why?
So that he won't get his new position at High Cross. He'll have to stay here and support St. Swithin.
Oh, I see.
Now, are you with us?
No? I think I should tell Professor Loftus.
What?
Lawrence, you don't seem very surprised by all this.
Well, I'm not. I knew about this about 2 months ago. I mean, that's why I applied for a post at High Cross.
2 months?
I mean, come on, after all, what is St. Swithin's? It's only a name, isn't it? I mean, look, it's rubbish, isn't it?
What?
That's it, it's rubbish. What did you do that for? No, that's very clever indeed. I shall tell Professor Loftus what you two are up.
Well then, Bannister, what's the first thing you notice about this patient?
Papier-mâché, sir.
Shut up! He's quite right. It's called occupational therapy. Now then, Carter. The next logical step is to find out why he's doing occupational therapy. What's the second thing you notice, Carter?
Oh, well, sir, he's middle-aged.
He's also bright yellow. The sort of yellowness, Carter, you could spot from the door. I'm going to get you through these exams if it kills you. What are you doing here, Waring?
Oh, we thought we'd join the ward round, sir.
Good Lord. You as well?
Yes, sir. Yes, sir.
Well then, gentlemen, if 3 qualified doctors think they might learn something, you might have the humility to think so yourself. What was that?
Sorry, sir. Hay fever. Can't help it.
Right then, Carter. Give me 3 types of jaundice. Bannister.
Hemolymphic,
Good start, anyway. Tell them, Dr. Collier. Collier? Where's Collier?
He's just nipped out, sir.
I see. 3 types of jaundice, Dr. Waring. Waring?
Hemolytic, hepatocellular, and obstructive, sir.
Correct. Now, in this case, any one of you should have been able to make a doubt. Wait a minute, will you, Bingham? Now, which of the 3 types of jaundice is it? Anyone? I see, no takers. Well then, Dr. Stewart. Where's Stuart Clark?
He's just nipped out.
Well, then you have to speak for him, won't you, Dr. Waring?
Yes, of course, sir. Hemolytic is a mild lemon yellow colour, and hepatocellular depends on the degree of liver damage, sir. And
No need to shout, Bingham.
depends on the degree of liver damage, sir, and its cirrhosis may be absent.
Correct. Well, now, that most probably leaves obstructive jaundice. A much more intense colour, often almost dark green. Now, there also, from outward appearance, is the presence of xanthal asthmata, a yellowish plaque situated near the inner canthus. Take a close look, Jim, will you? Now, what was it, Bingham? Where's Bingham?
he's just
Nipped out,
sir.
Collier,
Sir?
I don't know what's going on, but whatever it is, make sure it stops, will you?
Yes, sir.
Now then, you all know what xanthal asthmata looks like. What was that?
Bravo! Wonderful dental atmosphere, sir. Excellent.
If you could give this to Professor Loftus, it's most urgent.
No, this obstruction of the biliary tract is either total, incomplete, or intermittent. And obstruction to the lumen, such as calcium, the common bile, or hepatic ducts, and ampulla.
I'm sorry to interrupt. Please, Colin, Stuart Clark.
Right? That's it. End of teaching round.
Sir, I must...
I've had enough for one day. Ignorant students. Doctors squeaking like pregnant goldfish and disappearing every 5 seconds. Now you Bingham belling at me from the other side of the wall without your trousers.
I'm sorry, sir.
Waring,
Sir?
Was this little display of yours a rehearsal for my guest this afternoon?
Oh, no, sir.
Good. Because it might have qualified us for a huge grant as a lunatic asylum.
Professor Loftus, sir.
Bingham, would you do a poor old man a great big favour?
Oh, yes, yes, of course, sir. Who?
Me.
Oh, yes. What is it?
Please don't let me see you for the next 24 hours.
Hello? Hello, is that Sir John Pollock? This is Dr. Lawrence Marwood Bingham here from St. Swithin's. I don't know whether you've heard. Oh, you have? But I thought I'd better warn you that some of the junior staff are planning to disrupt your visit this afternoon.
I see.
And actually, what they're planning to do is...
Thank you, Dr. Bingham. You were absolutely right to tell me. And now I'm going to tell you something in confidence. We don't actually want Sir Geoffrey at High Cross at all. And if you can help create a bad impression of Loftus this afternoon, I shall be extremely grateful, if you see what I mean.
Oh, yes, I do see, yes. Yes, right. Well, I will. You know, I'll think of something to do, yes. Goodbye. Gosh.
Well, that's Bingham fixed.
I knew he'd try and phone Pollock.
Oh, it pays to have a friend on the switchboard, dear boy.
Well, everything is ready, and ladies and gentlemen, remember, the worst hospital in the world.
The worst hospital in the world.
Sir Geoffrey, this is Lord Wagstaff. He's here to act as an impartial observer.
Good afternoon, sir. I'm sure you'll like St. Swithin's.
What?
I'm sure you'll like St. Swithin's.
Oh, no, it didn't rain, did it, thank God? 40 days of that.
Sir John, you do choose well.
Well, Sir Geoffrey, we are here as promised, but I really don't think our visit is going to change anything.
I'm sure it will. Now, as arranged, I've told no one who you are. You'll see a normal working day, and I'm sure you'll be impressed. Come in. Dr. Waring, this is the gentleman I was talking about. Mr. John Price, a friend of mine, and a friend of his. All right, John, I must go now.
Right.
I'll see you before you go. Dr. Waring will take good care of me.
Well, what would you like to see first?
Anything you like. Just show me round. I'm not a medical man, so if you could perhaps spare me the gorier... Professor Loftus tells me he's very proud of the staff-student relationship. Do you enjoy working here?
Yes, well, St. Swithin's, it's a marvellous place, you know, and, Professor Loftus has worked wonders.
Oh, I'm sorry, is Sir Geoffrey here, sir?
No, he's had to go out.
Excuse me. I wonder if you could help me, sir. I'm having a bit of trouble with a gash I made in the aorta.
Don't bother me now, you stupid fool. Just go and patch it up.
What with?
Well, I don't know. Look it up in a book or something. Well, you've got it clamped, haven't you?
Well, sort of. But I keep being jogged by the other students.
Excuse me just for a moment. Now get back in that damned theatre and remember to scrub up again before you go in this time and don't bother me again. Should we go, sir?
Is that a student?
Yes.
In charge of an operation?
No. Professor Loftus is actually in charge.
But he isn't there.
Well, no, he's not actually in the theatre, no, but, well, he's in charge of things, you know. In fact, he's in charge of quite a few things. Shall we go? Oh. I think, first of all, we'll visit the surgical lecture theatre, and then after that, we'll have to go on to one of the... Oh, dear. Perhaps we'd better go this way.
Down, theatre sister!
Yes! It wouldn't have happened if you hadn't been groping Nurse Grace.
She didn't touch me. You're only jealous.
Oh, maybe we should go this way, sir.
I'd like to go this way.
Anyway, you're a fine one to talk. You can't keep your filthy hands to yourself.
Look, will someone please tell me why I've got to have my leg off?
Do you mind? I'm the doctor.
Look, I don't want my leg off. I'm only here for my wisdom tooth.
Will you shut up about that stupid leg of yours?
Oh, hello. Perhaps there possibly has been some slight mistake with your notes.
Yes, there. Now, don't worry. Hello, Dr. Waring.
Well, perhaps you'd like to see the preclinical block first, eh? Oh, this way, sir.
You're not a nurse, you're a filthy slut!
What about my leg?
Will you shut up about your stupid leg? Shut up!
High spirits, sir. This way.
Well, which is the preclinical block?
This one.
You mean it isn't built yet?
Oh, no, there's a foundation stone in there somewhere. Some bigwig's harebrained scheme.
Not.
No, not Sir Geoffrey. Mind you, I suppose, technically he was in charge.
Noreen, race you to casualty.
Right! On the point, on your mark, set, Come on! You missed the finish! Lazy thing. Oh, Wednesday afternoon, sir. Patience races.
Howdy, Warren. Who's this punk? I'd just like to say, as personal assistant, this is Jeffrey Loftus. I'm sick and tired of the way he's running this hospital. Son of a bitch. Well, I'll be moseying along. I'll see you later. Goddamn Loftus.
Excuse me just a moment, please. What?
It's me, Lawrence.
Really?
Listen, I've just had a marvellous idea.
What is it?
I told a few of the chaps in the rugby club that it was him, Sir John Pollock, who's going to pull down St. Swithin's. You know, so they were trying to put on a bit of a show.
The rugby club? They'll kill him. Thank God you told me. Look, you go and warn them off.
I think it's a very good idea.
Well, it isn't. You know what they're like when they get back from a match? Now, you stop them doing anything or I'll kill you.
Trying to help.
I'm awfully sorry. I really wouldn't have shown you the dissecting room if I'd known you were so, well, I mean, I suppose anybody would be squeamish showing those students with that abdomen. Well, they don't normally do that. It's just unfortunate you have to come on this
I'll
afternoon.
pay you back for this.
You and who else? I warn you, if you touch me, Professor Loftus will have you thrown out.
Ha, why should he?
Because of the photographs I've got of him and Nurse Willett. That's all right, Dr. Collier. We'll do the operation if the x-rays are all right.
Fine, Dick, old chum.
This way, sir, if you please.
Ah, there you are, sir. I wonder if you could spare a moment. We don't know what to do with the spleen.
That's interesting, these things, aren't they? Far cry from the old days.
True, yes. Is everything all right, sir?
Yes. Thank you. Thank you. I think we've seen enough for this afternoon, thank you.
Oh, dear, we've still got the mortuary, sir.
No, thank you. And thank you for all the time you spared us. And please say goodbye to Professor Loftus for me.
Yes, of course, sir. Goodbye, sir.
Quite effective, I think.
Oh, yes, well done, Bannister. Thanks, Carter. Mind you, Bingham almost messed it up there.
Why?
Well, he tried to get some of the rugger team to go and do in Sir John Pollock. But it was OK. I caught him in time and told him to go and stop him.
Oh, dear.
Oh, dear, what?
Well, we stopped him.
Eh?
Well, we didn't want him messing anything else up.
What do you mean?
So, well,
Just after Bingham left you and Sir John.
we gave him a local anaesthetic.
Yes, and tied him up and locked him in the chapel.
Oh, my God. We've got to stop him! Quick! We're very sorry, sir.
Extremely sorry.
Yes, sir.
And, well, we did it for the hospital.
Sir.
Yes, we did.
And, well, we thought you were leaving, sir.
We're glad you're staying, sir.
Yes, we are. We are.
I don't know when I've ever been so angry. Well, I'm out trying to save the hospital. You're here trying to wreck it. I don't think anything can save the hospital now.
But we did it for the hospital, sir.
Yes, so you've said. It's very touching. Quite understandable. And bloody stupid!
Professor Loftus!
Not now, Perky, please.
Sir Geoffrey. Sir Geoffrey, I have just found this young man dressed like this, screaming muffled swear words in the chapel. Which of all places ought to be treated with respect. Not only because it's a holy place, but also because it's the oldest part of the hospital. Without it, there'd be no St. Swithun's. And the way it's treated...
What was that?
You don't realise. No one ever listens. There has been a hospital on this site since 1112. And you won't bloody listen! I'm sorry. I don't know what came over me. I feel quite faint.
Don't worry, Chaplain. Don't worry. It's one of those days when you feel like swearing.
Sir, did you realise that there'd been a hospital on this site since 1112?
You fascinate me, Waring. You ought to talk to the chaplain about it sometime.
No, sir. But they would hardly dare build a hotel on the site of the oldest hospital in the country.
Waring, I think I'm going to buy you a drink.
Thank you, sir.
Is this true, Chaplain?
Oh, absolutely. All my findings have been verified.
Well done, Chaplain. You have just saved St. Swithin's Hospital.
Really? You see, historically...
Oh, sir, that drink?
Good idea. No. Listen, this is fascinating. You too, Bingham.
But before I explain that, perhaps I better give you the background of the method of dating objects called thermoluminescence. Well, perhaps I better explain. Every object has a natural amount of radioactivity in it. Except, of course, when clay is fired in the kiln, it loses its radioactivity. Yeah, well, perhaps I better explain. It's a method fairly recently discovered in Oxford. Very interesting, very interesting. Where was it? Oh, yes.